Jeff Avery was a firefighter with Johnson County, Kansas for 27 years. His work meant everything to him, but it was brutal. He wrestled with PTSD, anxiety, and depression. Looking for a solution for his sleepless nights, Jeff turned to drugs. Pot at first, and eventually prescribed opioids. It became really hard for him to continue working the job that he loved. He decided to end the pain and take his own life. On what would have been his last car ride, he got into a car accident. The police noticed something was wrong and, together with their co-responder, committed him to the state hospital. This was followed by intensive outpatient care, medicine, and therapy. Today, Jeff works as a caseworker at the Johnson County Mental Health Center after being promoted from a peer specialist role. There, he helps others gain hope and recover. We had the pleasure of meeting Jeff a few weeks ago and hearing his story. However, many others don't get to tell their stories. In the United States, suicide and death by drug overdose are a huge problem and a leading cause of death. In 2020, there were over 45,000 deaths by suicide. This is one death every 11 minutes. Moreover, 12.2 million adults reported having serious thoughts of suicide, and 1.2 million went on to attempt it. Drug overdose is also a huge issue. In the same year, there were 93,000 deaths by drug overdose. This is a 30% increase from the year prior. Generally, for behavioral health crises, reactive care is later than what is ideal. Timeliness is of essence when it comes to having effective behavioral health care. This summer, we have partnered with the Mental Health Center from Johnson County, Kansas, and the Criminal Justice Coordinating Council from Douglas County, Kansas. Our partners currently only reach out for behavioral health care to new people via referrals from concerned neighbors. However, as I just argued, this is sometimes too little too late. Today, they have the resources to proactively outreach to 115 residents a month. And they have asked for our help in identifying who to prioritize with their limited resources. We help them stage early data-driven interventions. Throughout our work, we aggregated data from multiple sources, including EMS, jails, emergency departments, and police, to build a machine learning model that equitably predicts 115 individuals at high risk of experiencing a behavioral health crisis in the next 6 months. This list is then shared with the partners, behavioral health outreach teams, who get in touch with people to get them the help they need. Over the course of the past year, our model would have been able to intercept 9 suicides and fatal overdoses, 54 suicide-related ambulance runs, and more than 800 behavioral health-related ambulance runs. Based on these results, we believe our model has the potential to, number one, ease the strain on first responders, and number two, improve behavioral health outcomes. Though our work is done exclusively with Douglas and Johnson counties, our partners, it is our hope that this can serve as a basis to tackle behavioral health crises going forward. Thank you.
There are 15,000 vacant properties in Baltimore City. This is what a vacant home typically looks like. It's a row home with boarded up windows, overgrown lawn, and parts of the house that are falling apart. If you live next door, you'll experience a host of problems: rats, trouble getting insurance, and parts of your own home being damaged by connection. The city government is tasked with inspecting these vacant homes and taking the appropriate intervention, such as stabilization or demolition, for the health and well-being of its residents. A major challenge for the inspector is determining whether this home has damaged roofs. From the ground level, it's difficult to tell what the condition is. Roof damage is a serious problem that should be detected early because it lets in rain and other elements and causes damage to the house itself and the houses around it. Another challenge is that there are so many houses to inspect across the city. In 2018, the city hired a handful of interns to look at aerial images and label the roof damage to mitigate this problem. The interns looked at 2,400 blocks and identified 1,244 damaged roofs. This resulted in 7 emergency demolitions for public safety reasons. While it was useful, it was difficult and too expensive to do for the whole city, much less continuously over the years. Our team collaborated with the Department of Housing and Community Development in Baltimore City to identify damaged roofs in a more scalable way using machine learning. We used aerial images of the whole city in combination with the 2018 intern labels, housing inspection notes, 311 calls, and other city-provided information. And our models assigned a roof damage score to each address in the city. This list can be ranked, and the top 1,000 can be prioritized for inspection. So before we even start building a machine learning model, we took a look at a bunch of pictures of damaged roofs and noticed that they all had a lot of dark pixels. So we took a very simple approach of calculating the proportion of dark pixels in the images as a proxy for roof damage. This worked fairly well, where the simple dark pixel approach captured 468 known damages in the list of 1,000. When we use machine learning that learns from this dark pixel information, in addition to inspector notes and other data, there's another 320 known damages captured in the list. And when we add a neural network that classifies the images, it adds another 46 to the list. This was our best performing model, where 834 known damaged roofs were in our list. In addition to the known damages, it also caught 80 previously unknown damaged roofs that the interns had missed. So given these results, what is the impact of our work? First, the inspections can happen more efficiently, where the inspector will have a list of 1,000, where 904 have damaged roofs. This list can be regenerated every year with machine learning and minimal annual effort, manual effort. And second, the city government can operate more effectively, where they know about 80 damaged properties that they didn't know about before. Third, the interventions can be made more equitably because our model is not biased and doesn't disproportionately miss roof damages in different neighborhoods. Most importantly, this has the potential to improve the lives of 5,000 households who live on the blocks with damaged roofs. Thank you.
This summer we worked with the Indus Hospital and Health Network in Pakistan to improve workflows for clinical diagnosis. On the team with me was Muredi Fatunde, Jenna Goshak, and Christina Last. Let me lay the problem we've been working on this summer. So IHHN is a non-profit hospital in Pakistan that provides free medical services. And as you can already tell, with any public good comes challenges with it. At IHHN, this challenge presents itself in the form of overcrowding in the ED, which is sort of shown on your screen right now. And just to set up this problem further, 98% of medical service providers in Pakistan, including IHHN-run clinics, report that they're ill-equipped to handle emergencies. And just to set up this problem even further, every 2 to 3 minutes, somebody walks into the ED at IHHN. Now, once a patient walks into the ED, the focus of triage is to assign care as quick as possible. And sometimes this is at sort of the expense of long-term efficiency. And when I'm talking about long-term efficiency here, I mean the use of the international classification of disease codes, right? At this point, you're probably asking yourself, what are these? So let's take a look at it. So on the left-hand side of your screen is an ICD code. Basically, it's a health management code, right? And the focus of this presentation today is the first three characters, right? So the first three characters represent the category, and those categories sort of map onto diseases, right? So you can see on the right-hand side of your screen, for example, J45 represents asthma, and I50 represents heart failure. And at this point, you're probably asking yourself another question. So how do these ICD codes map onto efficiency? So with hospitals, for example, in the US and in Europe, these ICD codes are used for, among other things, to sort of improve downstream workflows. So for example, what investigations will be assigned to a patient. Number two, they can be used to sort of monitor disease incidence in the population. And number three, they can be used for billing. Now you can begin to see how these ICD codes will be sort of very important in hospital. So IHHN currently does not have this sort of system in place. And so because they realize the importance of these ICD codes, they have been trying to implement this, right? And so on a trial basis, they've been able to, on average, sort of code about 9% of doctors' notes every month. And this is where we come in, right? At Data Science Social Good, we think that you can help them to code these notes more efficiently. So how do we do this? We take notes from the health management information system. And the data includes sort of tiered notes, some other notes, for example, like vitals, history of presenting illness, and so on and so forth, right? The large chunk of this data set is basically textual data. We feed this data into a machine learning system, and it outputs a list of 10 ICD codes, which we then suggest to a physician or a doctor, and that looks something like this, right? And so the doctor can go through this list, right, given the patient is seen and what notes is entered into the system, and sort of choose what is correct and sort of remove what's wrong. And you can begin to see the benefits of this system, right? Instead of coding the doctor's notes themselves, now the task shifts to sort of correcting and verifying that this ICD codes are correct. So with our models, our results indicate that we can capture an average of at least 90% of the correct codes when up to 10 codes are shown by the system or recommended by the system. And so at Data Science Social Good, well, what I've spoken about up to now basically speaks to the business process of the hospital. But at DSSG, we are more people-centered, we're more people-centric. And in this field, we think that this system will help IHHN in three main ways. So number one, better patient outcomes. Number two, there'll be better disease monitoring. And number three, there'll be sort of improved training for physicians. And from Team IHHN, thank you very much.
Does anyone know what this number means? 50 million is the estimated number of people in the United States who live with a mental illness. Mental health problems are a huge issue in this country. And this is what motivated the creation of the National Suicide Prevention Lifeline, which is a network with around 200 call centers distributed around the country. Every year, the Lifeline receives about 2 million calls from people with the need of mental health support. But unfortunately, around 300,000 calls are abandoned before they reach a counselor. Vibrant Emotional Health is a nonprofit organization that runs the National Suicide Prevention Lifeline, currently known as the 988 Suicide and Crisis Lifeline. This means that they are the responsible party that decides which calls get routed to which call centers. But how does the routing process work? Well, call reaches the lifeline, and then based on the current routing logic, the call is transferred to one of the available call centers. Different call centers have different capacities at different times, and that highly impacts the probability of each call being answered in time. This is a decision that Vibrant Emotional Health needs to do in order to help the lifeline. This summer, together with my fellows Charles, Irene, Tejumar, and myself, Pablo, work with Vibrant Emotional Health in order to improve the current routing logic so that more callers can get the help they need faster and in an equitable manner. In order to know which calls should get routed to which centers, we should know the current capacity of the call centers, the current waiting times, and how much each caller is willing to wait. Unfortunately, due to the distributed nature of the network, we don't have that information. But luckily to us, our partner provided with the call history data from the past 3 years that contains where each call came from, the call centers where the calls were routed to, the waiting times, and whether these calls were answered or not. With this data, we were able to build a prediction model that predicts likelihood with which each call will be picked up or not in a specific call center at a given time. This model performs 20% better than any simple data-driven approach that the Lifeline could use today. Using this prediction model, we built a routing simulator that reproduces what will happen to a set of incoming calls given a specific routing logic. That means that we are able to predict how many of these calls will be answered in time given that particular routing logic. We run a number of simulations over a specific set of incoming calls over multiple routing logics. And as of today, we found a routing logic that predicts a 1% increase in the overall answer rate in comparison with the Lifeline's current approach. This means that an additional 20,000 callers, 20,000 people in need of mental health support may get the support they need in time. Thank you.
Please raise your hand if you've ever made a mistake. Well, aside from the few amongst us who apparently are saints, we've all made decisions that we regret. It's part of the human condition. We stumble, we fall, make amends, and learn to do better. Depending on the nature of our mistake, the criminal justice system might be the entity that guides us through what is intended to be a rehabilitative process. Probation is the most common correctional sentence in all US states. It refers to a period during which an individual is expected to comply with a set of conditions that are mandated by the court or be faced with incarceration or heavy fines. In the US alone, about 3.5 million people are under supervised probation in a given year. While the intended outcome or the desired outcome of probation is that the individual does not break the law again, what we see in practice is that the same people keep cycling through the system. And this becomes a vicious cycle within the criminal justice system. In Kansas City, Missouri, about 1 in 10 individuals who had cases in 2021 returned with new cases in the first half of 2022. Probationers in Kansas City, Missouri receive community service outcomes. Helping these familiar faces is a top priority for our partner, the Kansas City, Missouri Municipal Court, which deals with offenses like speeding, petty theft, and disorderly conduct. Probationers in Kansas City, Missouri receive a number of conditions to complete within their sentence, including community service of up to 100 hours, substance abuse intervention programs, and anti-theft classes. While these conditions are tailored to defendant's charges and are aimed at rehabilitation, they're often costly in terms of registration fees as well as time. And we found that about 50% are left incomplete. This may have downstream consequences for the defendant, such as an extension of their sentence or the issuance of a warrant for their arrest. Which begs the question, are these terms actually effective? So how can we evaluate probation term effectiveness? Experimentation. We partnered up with Kansas City, Missouri Municipal Court in order to set them up with a pilot evaluation program that allows the court to independently assess the effectiveness of their probation conditions. In one planned version of the pilot program, in the probation terms are either kept or removed, such as community service probation kept or removed. We then decide on a risk category for each individual based on their likelihood of returning back with new cases. This is done by using a machine learning model based on characteristics such as race, sex, and charge type. The court then compares outcomes across the risk groups. So here we see an illustrative example where removing the community service probation term actually leads to better outcomes and reduces the likelihood of a new case being acquired by the probationer, specifically for the high-risk group. Such information can allow the court to make more tailored decisions in terms of probation allocation, and hopefully and potentially lead to more equitable outcomes. Furthermore, the court can alter and reapply the design as needed to test other practices within the court. With our recommendations, the Kansas City, Missouri Municipal Court can measurably improve the way that they allocate probation terms. And by doing so, can help up to 6,000 people a year stay out of the criminal justice system in Kansas City, Missouri. Thank you for listening, and a big thank you to our partners at KC. Just kidding.
Every year, 3.6 million evictions are filed in the United States. In Allegheny County alone, 37 people have evictions filed against them every single day. This is a map of the city of Pittsburgh, where we are right now. Here, each dot represents one of over 13,000 people who had evictions filed against them in 2018 alone. Eviction is already an incredibly disruptive moment in a person's life, but for some, their story gets even worse. Here, we highlight those who fell into homelessness within 1 year of their eviction filing. Eviction is a pathway into homelessness, because 1 in 4 low-income families spend over 70% of their income on housing alone. When you're spending that much on just your place to live, you're living one step away from losing your home. Allegheny County is trying to help these people by providing rental assistance to those facing eviction who are likely to fall into homelessness in the near future. But this isn't an easy thing to do. In fact, it's like trying to find a needle in a haystack, because only about 2% of people facing eviction will fall into homelessness in the next year. The current system for allocating rental assistance is reactive, requiring the person facing the eviction to call sometimes multiple times to end up on a wait list. And this misses out on many others who need help. We'd like to make the system more proactive and give people the help that they need based on their risk. As data scientists, how can we empower the workers at Allegheny County to make more informed decisions so that they're better able to allocate their rental assistance program and other resources to those who are most likely to fall into homelessness? The good news is, through Allegheny County's data warehouse, we have this rich, previously untapped data source that we can use to help, which includes information on previous evictions, homelessness spells, mental and behavioral health, various involvement in support programs like food assistance or childcare, and much more. Using all of this data, we want to figure out whether there are historical signals in a person's interaction with these services to see who is most likely to fall into homelessness in the near future. We can start by making one simple improvement that's data-driven, by just using one of our data sources, previous homelessness spells. By prioritizing people by the number of days since they were previously homeless, where more recent homeless means higher risk of homelessness in the future. Out of the 100 people that Allegheny County can provide rental assistance to every single month, we would capture 15 of those people with just a simple approach. The downside of this is that you're only capturing people who have been homeless before and never people who would be entering into first-time homelessness. But with all the data that we have, we built a machine learning model which captures 25 people who will enter into homelessness in the next year. And not only that, but it does it more equitably. We're not only capturing people who entered into first-time homelessness, but we also made sure that we don't have any disparity across different demographics, such as race and gender. Using this model, Allegheny County can better impact those who are facing eviction who are likely to fall into homelessness, proactively helping 250 people who will fall into homelessness every single year. Thank you.
Okay, wow, that was great, right?